Yeah, so we basically did a study at Memorial of all of our patients who were treated with PD-1 inhibitors for melanoma only, and looked at what happened after they discontinued, which is a growing question in our field. And essentially what we saw is that many of the responses really are durable, in line with the clinical trial data that we've seen. But over a period of years, we've seen increasing relapses, raising this question about how long we really do need to treat particularly after complete response. That's an open question still, and certainly not one that we answered, but our estimated 3-year relapse rate after CR was actually 27%, which is much higher than I think many of us, and myself included, expected. So then we went on to look at what happens when we give patients who did relapse a second course of PD-1, and we were quite surprised to see that the response rate was somewhat lower than expected, 14%. But very interestingly, the response was actually independent of their first response. So we had patients who had a complete response the first time, 8 of them, and only 1 even responded to a second course of treatment. In contrast, we had 8 patients who had progressive disease to their initial course, were retreated with PD-1 for whatever reason. Actually, 2 of those patients responded to a second course. So it's very interesting, suggesting, things are changing in the tumor with whatever interval treatments they are having. Clones are evolving, resistance patterns certainly change. So very interesting and compelling, but lots of work to do to follow up on that. We're starting to look at that. So we looked at patients who had either systemic therapy between the 2 courses or radiation therapy, which we know may change the tumor microenvironment. But some patients didn't and still had a different response the second time. So, I'm a translational scientist. Our next step is to take that back to the lab to really try to analyze those tumors genetically and from a microenvironment perspective.